Orla Tuohey and I work for the Lifestart Foundation. And the reason we choose the Lifestart Growing Child programme was because we had an interest in children's developmental outcomes, and we were very keen to look at the ways that we could support parents to improve children's outcomes. And the Growing Child was developed, I suppose, in a response to a perceived need within communities that even the likes of teachers were seeing that some of the children coming to school were already disadvantaged by the time they reached the school setting, and even in some cases in the preschool settings. So they were interested in looking at what were the elements involved in maybe improving these outcomes, particularly in terms of readiness for school. So at this stage, and we're talking about maybe 25 years ago, we already knew that there was two main kind of elements involved in improving children's outcomes. And the first of those is parental home learning environment, and the likes of nurturing the parent-child relationship. And the second really important thing is the nature of the home learning environment, and that could be a parent and child interacting through play and also how they read together, but importantly kind of child-centred activities and what they might look like in the home. We were looking at really improving children's outcomes and also family well-being over time, and the ideal way to do that is within a community setting. So working with community actors and also parents to improve outcomes for children in the family and then again in the community. So at that stage, and again we're talking about 25 years ago, we actually started helping parents in two particular communities. So one of those was in the Galway area, and the second one was in Derry. And through a needs analysis process, we were looking at the families and kind of thinking about what do we need to be doing here. And we actually sourced a program in the US, which had been developed by educationalists and psychologists. And at that stage, it was in a magazine kind of format. So the process of changing that into a home visitation service and manualising the program, looking at manualising the whole training and then delivering the training, thinking about the whole quality assurance system. This all took about 2 or 3 years at that stage, again, about 25 years ago. We were looking at what's the best way to turn this into a workable process. So we looked at, again, how can we best kind of fit this programme into the Irish context? Again, so that took a bit of work, and it kind of involved working with the different stakeholders within the community. And again, as I was saying before, there was a lot of work put into manualising the programme, doing the training initiatives, but also looking at a really robust quality assurance process and how we would support practitioners that would be delivering the programme. And this also took on the form of looking at the coaching kind of needs of the family visitors. Probably the main challenge we found was actually standardising the programme, because at this stage the programme 20 years ago was being delivered by quite different and diverse communities. So we had a range of programme deliverers throughout the country, and we also had international partners. So we were engaging with groups in Barcelona, in Macedonia and also in Zambia. So there was a bit of a challenge to actually standardise the core piece of practice so we could manualise it and kind of copper fasten, if you like, the process to enable us to deliver an evidence-based programme. We were looking at how we could evaluate the programme, and we were very lucky to be involved in a randomised control trial. So this enabled us to engage with a group of families, and we had quite a large number in this study. There was over 420 families, and they were then allocated randomly to two groups. And in this way we were able to demonstrate over time that the programme was actually doing what it said it would do. And we've just actually received the results that will be in, say, January 2015 of the randomised control trial, and they are very positive. So we've been lucky to go through this process. So we can guarantee families that and family visitors that are delivering the programme that because it's an evidence-based programme now, that we can ensure that the children are actually going to get improved outcomes over time. A lot of stakeholders are very keen and close partners throughout this work. So we would have worked with health and social care professionals throughout that time. We worked very closely with the public health nurses, also the social work system, because we're trying to get Lifestart to be a totally integrated system and service. So in some areas in Ireland, it's fully integrated into the family support model. And this means that we have a close relationship with the likes of the public health nurses, the social workers, and also the likes of the early years educators and indeed primary school teachers as well. And then that took quite a bit of time in terms of looking at the training needs. And again, it was linked to the standardisation process. So we took a bit of time, and it took actually quite a few years and quite a lot of resources in terms of developing the training. But we believe now we've got a very robust training system. We've manualised the training process. We've actually manualised the process. And in this way, we can ensure that with the proper supervision and coaching, that the programme is delivered with fidelity. And again, it's all linked to improving and ensuring that we can help families to improve outcomes, developmental outcomes for their children. So we're continually evaluating our training to make sure that we are keeping up with the latest trends in terms of programme delivery, but also crucially that we're keyed in to the latest thinking and the latest kind of evidence around what is working for parents and what's working for families. So that takes a bit of effort as well too. At this stage, we would have worked very closely with our partners and indeed our family visitors to make sure that they were kept informed throughout the process. So we would have shared our manuals with our delivery partners and our funding partners and other stakeholders. We would have carried out presentations within the community to make sure that the other professionals that we were engaging with and that do have an impact on children's outcomes were fully informed about the work that we were doing. We also carried out presentations within the community, so we would be working with the likes of the school teachers, so they would be aware of the programme if it was being delivered within the community. And we found this was very effective in terms of keeping that kind of broader group of partners, including parents, kind of fully aware of the work that we were doing. The process, the whole implementation process, was actually being very kind of crucial in terms of providing a quality service. And we found this made it easier for staff, and they were much more confident in the delivery of the programme. They had very well resourced manuals and protocols in which to back up their work. And we found this actually engendered a really strong commitment to the programme. And so they were much more confident in their ability to provide a quality service for the families that they were working with. Through the whole implementation process, we've been able to ensure that we are delivering an evidence-based programme. And it follows very closely to the Lifestart logic model. So this is the model that we would have envisaged before we started the process. And within the Lifestart logic model, we'll see a change then in parental capacities first. So you see improved parental confidence, improved knowledge around children's development, and less stress on the part of parents. And this then in time will impact then on children's outcomes, and that's exactly what we predicted. So children receiving the programme have improved developmental outcomes, and again, it's a whole child approach, so you're looking at improvements in social development, emotional development, cognitive development and physical development, as well as a really strong impact on their school readiness. So again, this is fantastic for families that are involved in the programme, that they also have the confidence that by engaging with the programme over a period of time, and we're talking about a period of 3 to 5 years, that they're confident that coming out of that, their children will have improved outcomes, they'll be happy, they'll have really good relationships with their peers, and they're going to do very well at school. We were very lucky to have an RCT funded, so there's a randomised control trial, and this was actually carried out by Queen's in Belfast. It has been a long and challenging process, but we're happy to say that we're at the end now of probably what's been a 7-year process, because the program is 5 years long. So, but at this stage we can say that RCT has taken place and it has been successful with very positive outcomes. We also did a process evaluation, and this has been very useful to tease out some of the core issues around the delivery of the programme. It also enabled us to engage with the parents in terms of their perception of how the programme was, how they felt about the relationship with their family visitor. So that was a really useful process in itself. But I suppose in the learning within the implementation process, we have actually moved away from a way of delivering which was contract and affiliation based, and we've moved towards a social franchise model. And this has enabled us to look at kind of key processes within the programme to standardise some of the practice. Also to look at kind of how we manualise the programme, how we manualise the training. And we're very keen to actually engage with partners in Ireland, in the UK and Europe in terms of delivering on this social model way of working. Again, we've been around with quite a similar format for the last 25 years. We have got partners in the likes of Zambia and Africa, and that has been really successful in terms of outcomes for the whole community. It's in an area in Macedonia, which is quite near to Lusaka, which is the capital. And we had partners in Barcelona at one stage. So we're very keen to engage with partners throughout Europe and the wider community and internationally. What advice would we give in terms of people embarking on the implementation process is it does give you an opportunity to look at protocols, the way you do your business, particularly if you have a number of partners involved. It gives you an opportunity to standardise some of the core parts of the programme. And again, it's all about fidelity for the parents that we are working with. So it's to be really sure that we can produce an evidence-based programme and produce that with fidelity over time. So looking at the likes of the quality assurance process, what does that look like? Look at coaching for family visitors, what does that look like? And the support around that is so important. So yeah, we did a lot of lessons learned, but a very useful process in terms of getting things right for families and children.